On this episode of the St. Louis Pain Expert Podcast, we're going to be rebroadcasting a webinar. I'm talking with Dr. Ben Goekenbach and Andrew Mills of Achieve Wellness, and it's a three-way discussion on chronic pain. The title of the webinar was Untold Secrets of Chronic Pain. So stay tuned for today's episode. I think you're going to really enjoy this one. And if you do enjoy the episode, make sure to subscribe to our podcast so you get notified of future episodes. And without further ado, on to today's show.
You're listening to the St. Louis Pain Expert Podcast with Dr. Dave Candy, St. Louis's leading expert in chronic pain relief. Dr. Candy specializes in helping women age 40 and above to overcome chronic, nagging aches and pains without medication, injections, or surgery, so they can stay active, mobile, healthy, and independent. Whether you're suffering from pain yourself or know someone who is, pain's a universal experience that affects us all. But that doesn't mean you have to suffer. Knowledge is power, and having the right information can help you or someone you love get on the road to recovery. On the St. Louis Pain Expert Podcast, Dr. Candy talks with other pain experts from around the world to give you the information you need to recover, the peace of mind of knowing that you're not alone, and the hope that lasting relief from chronic pain is possible, and it doesn't require relying on pills, injections, or surgery in order to do so. So sit back, relax, and open your ears, mind, and heart, and let the healing begin.
Hi, my name is Andrew Mills, and today we're going to talk about chronic pain. We have a nice discussion panel put together today as we go over the different obstacles that come with chronic pain to better understand them. So this is called the Untold Secrets of Chronic Pain, and there's been this big disconnect between the problem that people face with chronic pain and the solutions they need to get better. I have clients of my own. We have our own facility. We do training, massage therapy, chiropractic. And one of the common things we always hear is, am I feeling this way just because I'm getting older? I have knots that just won't relax. Are you in a situation where you have pain and you're taking medication for it? The medication doses keep increasing and there's just kind of no end in sight. And those are the things we want to talk about today. So with this, I have Dr. Dave Candy. He's the owner of Movement for Life in Manchester. Dr. Candy is a board-certified specialist in orthopedic physical therapy and a fellowship-trained manual physical therapist. He's also the author of Chronic Pain. You're not just getting older. You're not crazy, and it's not all in your head. He specializes in helping women age 40 and above overcome chronic nagging aches and pain without medications and injections or surgery. Also with us is Dr. Ben Goekenbach. Dr. Ben is a doctor of chiropractic. He is one of the owners of Achieve Wellness. And one of the things he specializes in is sports medicine. That's what his master's degree is in. He's also a licensed massage therapist. And one of the things that's nice about this panel that we've got together is we get the multiple perspectives of the different allied health professionals. And I believe we're going to have Dave start us off here on that disconnect. In other words, why does one professional maybe fail where another succeeds, and how do we tend to do better together as we tackle this problem? What's the untold secrets?
Yeah, thank you, Andrew. Thank you for the introduction. I'm glad to be here today. It is a big problem. It's a societal problem, and despite all the research that we have on chronic pain, despite all the new technology, both in MRI imaging and surgical techniques, and despite all the new medical research, the problem's not getting smaller, it's getting bigger. And there are more people now relying on opioids than ever before, even though we're now trying to crack back on it. And so there's a lot of disconnect, and it starts from just the impressions that we have about chronic pain when we're very young, or pain in general, I guess, when we're really young. And that understanding of what it is and what it means, it just carries on throughout life. And people tend to look at pain as a very surface level that, I cut my finger and my finger tells my brain that it's in pain. And then when my finger heals up, it stops telling my brain that it's in pain. And just the total understanding of what pain is, I think or the misunderstanding of what pain is really at the heart of the problem. That pain at its surface level is basically your body's protective sense. So it has nothing to do whether things are actually injured. It's, hey, is this a good situation for me to be in, or is it not? If there's the potential for danger, or whether something has already been injured, like you cut your finger or you hurt your back, you can have pain in either event. And it doesn't have to just be physical danger. It can also be psychological danger. It can be chemical danger within your body. So there are a lot of different types of danger, and I'm sure we'll expand on all of those more. But it's a big problem, and hopefully these untold secrets that we're going to talk about will help enlighten some people.
Absolutely. And Andrew, I thank you again for the intro. And yeah, piggybacking off that same idea, one of the very common things I hear from my patients is like, oh, so how are you doing today? Those types of things in the morning. And they'll say, oh, it's just my regular pain. I'm like, pain isn't a normal thing. If you have a normal pain, that's not normal. And it fits right into that idea. It's a misconception of what pain really is. It's a warning sign. It says something's wrong, something deeper than just the surface, like getting the finger cut. And that's what most people understand, is that it's a short-term thing. You know, just like you were saying, you cut the finger, ow, okay, well, that's been damaged. And they don't really get when there's a deeper pain and it lasts for a long period of time. It's a more complicated problem than just a cut on the finger. So it's just a strange, like you were saying, a cultural idea, and it's just misconceptions based off what pain really is. And one of the analogies that I tend to use with some of my patients is it's the lights on the dashboard in your car. When the light comes on, there's damage already being done. It needs to get fixed. Well, if you ignore those lights, the damage just gets worse. So when you're feeling that pain, you're feeling the chronic pain, come in, start looking at what's going on. Maybe it's the chiropractor that needs to work on you. Maybe it's the physical therapist. Maybe it's a massage therapist. Maybe it's not one of the things that somebody on the panel has access to. But it is an issue that needs to be resolved.
I know a lot of people who drive with lights on in their dashboard. So it's not a real wonder why so many people are also ignoring these signals that they get and their everyday aches and pains.
Yeah. And actually, with that same analogy, the people that put the electrical tape over the lights, that's opioids.
Yeah. So what point here, just to clarify for people, at what point does a pain like a cut on the finger or maybe an acute issue, at what point does it become a chronic, larger problem that becomes more complex to solve than maybe just physiological? Either one of you.
Yeah. It's a good question. Textbook definition, there's a specific length of time that qualifies it as being a chronic pain. But for the most part, it ends up being just some type of pain that just will not go away. A lot of times it ends up being related to what we do for a living. Sometimes it has to do with genetic abnormalities, how our body grew. For example, I have a friend who had been born with a club foot, and after the surgery was done to fix it, he still walks with an altered gait, which will not change just because of the physiology of how the bones are shaped. Dave?
Yeah, like you said, a lot of times it gets nailed down to a time frame. 3 months is typically pain that lasts longer than 3 months, or some guidelines say 6 months. But really what it is like you said, pain that goes on longer than it should last, given the healing times. If you sprain your ankle, within 3 to 5 weeks, it should be back to normal, and you shouldn't be having pain anymore. If it's just pure tissue-based pain. If you hurt your back, usually you can get back to doing all your normal activities within about a month. And by 2 months, you should be pretty much unaware that it ever happened. But a lot of times, as you know, and as I'm sure many people out there listening know, back pain can last significantly longer than that, months or years or decades. And once it's past that typical healing guideline of a month or 2 months, it's chronic. And at that point, it's not just the tissues that you need to focus on. That's still a piece of it, but those tissues should be pretty much healed up by now. And so what else is driving this pain to keep going on, even after kind of the standard patient healing timelines?
So to summarize where we're at, so we have this situation where somebody's check engine lights may be coming on, and maybe they're in a situation where the acute physiological aspect of this injury is repaired. Maybe it becomes a reoccurring problem, something that's in constant need of repair. And then they get to a point where it becomes a chronic issue. It's not something that goes away. It's persisting. And although the physiological aspect of it, the actual injury itself has healed, what are some of the things that will perpetuate this pain? What prevents it from diminishing? In other words, how do we get the lights to go off in our dashboard?
Dave, you want to start this one off?
Yeah.
Sure, I'll go with that. That all kind of rolls back to the beginning definition of it, exactly, what pain is. If you drive with your check oil light on too long and your engine goes bad in your car, you just put a new engine in and it just works like new. Granted, there's some expense to that, but you put the new engine in, it's fine. Unfortunately, that's where the analogy kind of falls apart, is that humans aren't cars, and you put the new knee in to make the thing go better. It's not like just replace the joint. Pain is not the tissue injury or the tissue damage, but it's your body's message saying, hey, there's something going on here, there's something wrong, do something about it. And if there are more things wrong than just that arthritic joint, you still have the same muscles. You still have the same nerves that went to that joint. Those don't get replaced. You still have the same brain that's processing all those signals. You still have the same stresses at home and at work, and still have probably the same dietary flaws or lack of flaws that you had beforehand. And so there are a lot more things that go into, for this case, knee arthritis pain than just the joint damage. And that's why a lot of people, not a lot, 10% is about what the research shows, 10% of people who have knee replacements go on to have chronic pain at 1 and 5 years afterwards. And what really predicts those based on the medical research is anxiety and depression are the two biggest predictors more than anything else.
Yeah. Absolutely. And a lot of it links back to people believing that they don't have much of a choice, that the damage is done, there's no way to get around it, they don't know why or where it came from, and it's kind of that loss of knowledge, that loss of control that puts them towards those pits of despair. And a lot of times for example, the arthritis in the knee, one of the more common forms of arthritis, but it's still not terribly well known exactly where it comes from. It is overuse or underuse of the joint, but it's tough to nail down exactly for everyone what exactly drives it. But a lot of the issue ends up with poor movement patterns. And correcting those movement patterns can help to prevent and help in lieu of a surgery.
I agree. And, knowing both of you guys, I know we both, all three of us really, do that. And there are a number of cases where just correcting the movement patterns alone is enough to relieve the arthritis pain without replacing the joint. There are other situations where it's not. If somebody has a really high sugar, high fat diet, they have high cholesterol and high blood pressure, you might fix the movement pattern, but the system's still saying, hey, there's things wrong and I don't have a light on my dashboard for you're stressed out, you're not eating right, and so I'm going to tell you a signal you do recognize, your knee hurts.
Yep, exactly.
One of the things that I teach all the time with my clients, considering I work with people with chronic pain on a daily basis is kind of my thing. There's two aspects to this that I think I'd like to bring into this conversation. One is that we exist in multiple pillars of wellness. In other words, we tend to ask, if you were to go out on the street and ask people, what's your definition of wellness, you're going to get a million different answers. And what we tend to put in terms of a framework for this discussion is that, there's a physiological aspect, there's a mental and emotional, there can be a financial aspect, our environment that we're in, and we want to take a look at our wellness from multiple perspectives and recognize that, especially when it comes to movement, the human movement system, it's a system of systems that are then interdependent on each other. So we have our skeletal system, which if we have any joint deformities or damage, it's going to alter how we move. And then the other systems have to compensate. We have our nervous system, same thing. We've got our muscular system, and then we have our endocrine system and the cascade of hormones that also affect how we perform and move. And so as we kind of talk about, to answer some of these questions, like I have this knot that just won't go away, this is just always tight no matter what I do. Could you guys kind of talk about that and how that might relate to the perpetuation of pain?
Sure. You want to go first, Ben?
I'll
go. Right. I can talk on it.
But yeah, go for it.
Okay. So there are a lot of things. Like you said, there are multiple systems involved. And going back to the pillars of wellness, I think just understanding what wellness is, that I think a lot of people's common definition in society is wellness is a lack of symptoms. And by the time you have symptoms, you've been unwell for a while. That wellness is not a black and white. It's really it's a spectrum. And when you get so far down that spectrum, you start to have symptoms. So you're really just kind of having an understanding of what wellness is. But there are all those different pillars. And you mentioned all the different systems that can be involved in pain. If you do have a muscle imbalance where one shoulder is too low, you're not only overstretching those muscles, but you're also overstretching the nerves. Nerves don't like to be overstressed, and so overstretched. They're not meant to extend like muscles. And so they send a signal to your brain saying, hey, we don't like this. Your brain creates a stress response, which then has a specific response that happens both in the nervous system as well as a stress response that happens in the endocrine system. So it releases chemicals that basically tell you, hey, you're in danger, you have to prepare for survival mode. Those might be things like packing on weight to survive the cold in the winter. Those might be things like, hey, I'm not really all that worried about this problem right now because I need to get out of danger. Those might be things like, hey, I'm going to get my muscles all tense and tight, and I'm not going to let them go because I'm in fight or flight mode and I need to be prepared to run or battle at any moment. And so you live in kind of this perpetual ball of tension that your muscles are on guard at all times. And the longer that people have lived with that, I almost forget what it feels like to be normal. It's tell someone that's been in pain for a long time to relax, they say, I'm relaxed, even if they're tense. And it's not until they truly do relax that they realize just how tight or not relaxed that they were.
Yeah, there's always this funny moment, you ask somebody, they're like, I am relaxed, and they're real intense about it. And then when they say it out loud, they're like, okay, maybe I'm not as relaxed as I thought. But yeah, we always say, your body doesn't really know the difference between you being chased down by a lion and you have, a deadline this Friday that you're working to meet. And it also doesn't know the difference between, your body's being eaten alive by this lion or, your posture is just distorted. And so we tend to get these kind of mixed responses. And one of the things, I work alongside Dr. Ben, many times people will come in, there's this ball of tension and stress. There's a lot of emotions involved. And it's almost entirely predictable that as he starts de-escalating the situation and starts working through some of their issues, at a certain point we always hear their stomach growl. You want to talk about that, Dr. Bennett, and really what's happening there?
Yeah, so as far as that goes, that's a balance between autonomic nervous system. So in general, we've got basically three nervous systems that work at the same time. One has to do with motor, the other has to do with sensory, and the last one is autonomic and takes care of things like breathing and pumping your heart and dilating your pupils and all this other kind of stuff that doesn't take any conscious effort, right? And with the autonomic system, it splits into two parts. You've either got the sympathetic, which, as Dr. Dave was saying, is that fight or flight, you're constantly tense. I am relaxed, I'm good. And then when they finally do relax, like, oh no, I wasn't anywhere near that. And sympathetic is that running from a bear, you don't really know if it's a lion or if it's a deadline. And parasympathetic is the other one that kicks in, and that's the rest and digest. It allows blood flow to come back to the core and helps with tissue repair, helps with rest, relaxation, again, just like it says, rest and digest. It allows you to digest your food and get the nutrition where it needs to go. But a lot of people, just because the nervous system is designed that if you can't outrun the bear, it doesn't matter if you're digesting your food. So that one always takes priority. And if that's on all the time, it's exhausting because your body's constantly running and never gets enough nutrition. But yeah, it's a very interesting and hilarious thing when they start to relax and get the growl and they're like, I swear I'm good. It's very embarrassing because they're not used to those sensations. Their body is always on. So when they relax, it's new, which is kind of sad sometimes. We're so far removed from what it is to truly be relaxed and in balance that it's unsettling.
Yeah, I'm sure you've got some things you could add to that, Dave.
Yeah, I think like you pointed out, as soon as Dr. Ben gets people relaxed and calmed and kind of de-escalates the situation, and the world's actually not falling apart, and there is a solution to this, and we'll help you find it and take care of it. And I'm sure a lot of times you can explain exactly what it was that probably caused the situation. You can't just see this sigh of relief. But we have to be careful as practitioners because we can have the opposite effect too. That someone comes in with a problem, and a lot of people have late coat syndrome. They don't like going to the doctor's office in the first place, and that just gets them stressed being there. And then if you come in and you're in a rush to get to your new patient or to your next patient, and you don't sit down, you don't take the time to listen to everything they say, you interrupt them and keep interjecting your questions before they've had a chance to fully answer the last one or tell you everything that they felt like was important, then they feel unheard. They feel even more stressed. They feel like, hey, this person's just like all the other people that I've seen in the past that haven't listened to me, and they just want to give me a pill or do their massage or exercise or manipulation or whatever your thing is. And when that thing doesn't work, then it's on to the next. And I think it's really important to let someone voice what their individual problem is and what their concerns are, and then speak to those concerns, not just whatever your background or paradigm is.
Yes, yeah, one of the things that I've noticed is that people are so used to having to advocate for themselves all the time. I know for me, I'll be assessing someone's shoulder, and oftentimes, and I'm trying to bring this around so that we can give that answer of why does this not go away, right? Yeah. And so we end up in this situation where somebody comes in, my low back's hurting, and I'll start assessing their shoulder, and they're like, I said my low back, and it's like they're so used to having to advocate and not being heard. I think that's an incredible point to add. Dave, that sometimes we're so used of treating, let's go after the symptom, we're going after the symptom, that whenever we start looking for problems elsewhere within the body, because our body is interrelated, our shoulder is going to compensate and has to adjust for whatever's going on in the low back, etc., that they're just not used to that. And taking the time to listen to them, but then also set expectations on what we're doing and why, it goes a long way. But getting back to like this regional interdependence within the body and how these different systems work together, why would it be that somebody would go to a massage therapist again and again and the muscles just don't respond? Or maybe they see a chiropractor and they may hurt more after than they did before. Or they might get some care with a physical therapist, but then when they go home or maybe a week goes by, they're on their own, that they come back with the same symptoms and maybe not get as better as we would like them to. Let's start with you, Ben, as far as, since I started with the chiropractic aspect and massage.
Gotcha. So simplest way to put it is the body doesn't exist in a vacuum. Everything affects everything else in the body, right? But the more detailed version, so if they start and they come in for chiropractic, right, our emphasis is helping to move the joints, get everything mobilized again, and have everything moving the way that it's meant to from the foundation of the structure, right? But the muscles are used to things being in a particular pattern. So if the low back, for example, is, misaligned, all that stuff, as the muscles spasm to hold things in place and support, it's adapted to what currently is. And when you put it back, the muscles are still adapted to holding where it was. And if you don't take care of the muscles, they'll draw it right back to where it was because that's their holding pattern. That's what they're used to. They haven't had enough of a signal, enough time to adapt to what the new structure is. So it'll keep pulling back. And if you just use chiropractic over and over and over again, they're going to come in for the same issue because we're not fixing the other aspects that drive what's going on. So they may see some relief, but after a while that relief gets less and less or less lasting. And then they'll start looking for something else just because the entirety of the problem hasn't been addressed. But then if you start getting into working the muscles, that helps the adjustments to stay. It helps to release the muscles, and it helps the body to kind of find that balance and a more lasting effect in the therapies that are being done. And that's just interacting with chiropractic and massage, because there's a lot more beyond that. Mm-hmm. Dr. Dave?
Well, yeah, thank you for kind of bringing this around, Andrew, because we did kind of get off on a little bit of a tangent. But
yeah, I agree.
It was a lot of what you mentioned in your question is that the symptom doesn't go away if you keep chasing symptoms. That if you, let's say you have a weed in your yard and you see it there and you just keep plucking the leaves off, or you mow it down with the lawnmower, and it keeps coming back and it keeps coming back and it keeps coming back. That's because the leaves in the stem are not the problem. You need to get down to the root and pluck the whole root out before the problem goes away for good. And I think that's what a lot of practitioners and really the way that kind of people are taught in medical school, but not just medical school. I mean, even sometimes your PT school, and I don't know a ton about chiropractic school, but we end up sometimes treating symptoms and not treating problems. And, going back to your example, Andrew, that if the symptom is in the low back, but the problem roots back to a neck or shoulder injury from years ago, or the problem results from a surgery you had, an abdominal surgery or a C-section for a lot of women deal with that, where it affected the muscle tension and to some extent the ability to use the abdominal muscles. That can manifest years down the road as a compensation, for example. And so to truly get rid of the problem for good, it's not always about just get rid of the pain quick. And don't get me wrong, I'm sure we both do a lot, all three do a lot of things to get rid of the pain quick because that's what people want. But after you've gotten rid of the pain, what brought it there in the first place? And what do we need to do now that you've gotten away from the angry bear? What do we need to do to get you back into optimal function mode?
Yeah, it's one of the things I tell my patients pretty frequently is, okay, good, you're out of pain. Now we can start the work. And I also wanted to bring up something, because it's something we've kind of been skirting around as far as listening to our patients, kind of the culture of just hand them a pill and send them back out the door. A big chunk of being able to deal with the issue and actually make it move forward and get to the root of the chronic pain is having a patient or a client who can know or who can identify what their goals really are so that we can work with them. And if they have no interest in working towards a solution for long term, it's a waste of everyone's time, ours and theirs, to try. But we can educate them and kind of give them the seeds necessary so that they can find it and come back to us when they're ready. And I think that's part of why a lot of physicians are just kind of pseudo dismissive with a lot of pain things and just try and mask it because they're not convinced that they're really going to do anything to help themselves.
Yeah, I think that's a good point, Ben. One of the things that I confront frequently whenever I'm consulting and I'm working with people who are looking for exercise treatment for chronic pain. And there's this idea that I'm just getting older and that's why I have these problems, or they're in a situation to where they have forgotten what it's like to not be in pain. You mentioned earlier, this is just my everyday pain. And so sometimes, takes people by surprise when I sit down and they're like, I'm here because, I'm having these issues and I need them addressed. And I'm like, well, that's great. But, in 8 to 12 weeks, when this isn't an issue anymore, why are we here? What's the goal? Why are we doing this? We got to have some kind of intrinsic motivating factor here to push through that work, that we're talking about. Dave, you want to kind of jump on that?
Sure. Yeah, I think it is a misnomer that you're just getting older has to hurt. And, most people who've been in chronic pain, they've dealt with it because it hasn't been an issue and it hasn't stopped them from doing anything. It hasn't interfered with the way that they live their life. And most people can deal with some degree of pain. If the check engine light is on in our car, we know things aren't great, but it's not causing any immediate damage and it's easy enough to kind of overlook it. But as soon as that starts causing a problem and that problem impedes us from doing something that we either need to do or something that we want to do, then it's an issue. And that's where the pain really starts to escalate because as it becomes more of a hindrance to the things that people need and want to do, it actually starts to become a bigger problem, a bigger threat. And when something's a bigger threat, it causes more pain. And so the actual tissue damage may not have changed or maybe even has gotten better. But if it's limiting someone from more of the things that they need and want to be able to do, then that pain's not going to go away and it might even get worse. And the longer somebody worries about what's going on, why isn't it going away, why is it getting worse, that adds more stress, more threat to the problem. And so it gets worse and worse and worse. And so it becomes this snowball where it kind of becomes a vicious cycle. And our job, I think, is to start unraveling that vicious cycle. So kind of got a little off topic on your question, Andrew.
No, I think that
there usually is a driver, and people don't always know what that driver is, but it's usually there. The baseline thing, the question they know how to ask is, "Your back hurts, do you help?" But probably what they really want to know is, can you get my back to stop hurting so I can play with my kids again or my grandkids again? Or can you get my back to stop hurting so I don't have to go into a nursing home? Can you get my back to stop hurting so I can keep my job as a mechanic? Whatever the driver may be, it's not the back hurting, it's what the back hurting is keeping someone from doing.
That's a very good point. There's this interesting thing that tends to occur, when I'm working with people from a motivational standpoint. And anytime there's pain and it's persistent, like you said, it starts to get into the way of the things they enjoy. They start paying more attention to it. Sometimes this idea of hurt versus harm. In other words, there's a difference between I feel pain and it's a sign of actual injury that's occurring or has occurred versus just warnings. And this inability to tell the difference kind of creates this fear of movement, and we start to avoid certain things. And then that creates that cycle you're talking about. Now I can't go play with my kids because my knee's going to hurt more, my back's going to hurt more. But now I'm depressed because I never play with my kids and I'm getting old, and it kind of goes down this little rabbit hole. And that is that cycle. I mean, we know from research that as cortisol levels raise, just in response to the psychological stress, we're more susceptible to injury and lowered immune systems. And so we want to, like you said, unwind this. What are some of the things that you guys do to kind of identify hurt versus harm and start to address some of those fearful behaviors to where they may avoid these activities that may be necessary for them to get better? Ben, why don't you take off on that, because I know that is a regular thing we discuss in our clinic.
Yeah. So it's as a lot of the
it's a large, unwieldy subject, isn't it?
I was going to say,
chronic pain's complicated.
Talking about it's kind of complicated. Most of the time, what I end up linking back to is where I started off doing massage therapy, right? and trying to explain to people what the difference was between good pain and bad pain, so to speak. Because when you're working on someone, invariably doing the deep tissue work and working into the muscles, it's going to hurt because you're getting deeper into a muscle than most people ever really feel. And so there's signals that the body is receiving that it's not used to receiving or maybe hasn't ever received. And the body interprets that as a threat because it's new. So teaching them what a good pain is versus what a bad pain is, and the bad pain being more along the lines of harm, right? So just in like working with the shoulder, if I'm working on the shoulder and it's sore and it's sensitive, but they can breathe through it, okay, that's a good pain. It's having a good effect. Everything is working well. This is something that you can bear with. Now, if I get to a point where I get so deep that you stop breathing or you start tensing your jaw or you resist me, that's a bad pain. That means there's damage going on deep in there and we need to back off. And it's only one of the analogies that I use for it, but that was the first one that kind of came to mind as far as that goes, because in doing the good pain, so to speak, that's like a good classic workout. You have, the muscles are sore because you've worked them, you've exhausted them, and they're getting stronger. That's a good pain. But if you tear something, okay, that's a bad pain.
Yeah, and one of the things that I've noticed too is we start to interpret all stimulus our body feels as pain after a while. I feel things and it's bad. And sometimes I'll have somebody go, ow, 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 what are you doing? And I'm like, well, what do you feel? And then after they stop and think about it, they're like, I feel a stretch. I'm like, so you're not really feeling pain? They're like, well, no, I guess I'm not. Could you talk about that and how we kind of get this cascade of stimulus? Because I think that's what Dr. Ben's really talking about, from a soft tissue work standpoint is, we have this stimulus. Sometimes it's new, sometimes it's not. And we tend to have these subconscious interpretations of them.
Yeah. When, like you were mentioning, it depends how far down the path of chronic pain that you've got. That when some pain is just starting to become chronic, things that typically hurt might hurt more than they would if your nervous system wasn't extra on guard and extra aware of everything that was going on to keep you out of danger. It's like the sensitivity on the alarm has just been turned up a little bit so that your brain is more aware of things that could potentially make that pain worse. And when that happens and it's just starting, things that typically might cause a little bit of damage, they're interpreted as a much bigger stimulus. When you get really far down that path, things that should never hurt, like being touched lightly or having a feather top fall on your skin or even just wearing your own clothes, those things can be painful for someone who's been in pain for a long time. Other things that people here say is when it gets cold out or when the weather changes or when there's a change in atmospheric pressure or bright lights. Bright lights make my migraines worse. Things that typically shouldn't be perceived as painful stimuli can actually become painful stimuli. As far as where that line is as to what's good pain and what's bad pain, when your system has gotten that bad to where everything hurts, it's hard sometimes to tell, okay, is this just my system being more sensitive or do I really need to be aware of this? And so as I'm helping people get back into activities, the guideline I typically give is if it hurts a little bit during the activity, you can kind of expect that because your nerves are a little bit more sensitive and pretty much everything's registering on your radar right now. But if it's hurting 2, 3, 4 hours afterwards, or you wake up the next day and you're incapacitated because of what you did the prior day, whether it be an exercise, whether it be cleaning your house, whether it be going to see a massage therapist or a chiropractor or a physical therapist, if you're having more pain the next day as a direct result of what you did the prior, then maybe that was a little too intense. Maybe you need to back it down a notch. And so a lot of times people will ask, is it good to do this? Or is it safe to do that? And it's rarely a black or white answer. Is it good to jump out of a plane with a parachute? Probably not. But is it okay to exercise? Well, sure, it's okay to exercise. How much do you want to do it? How intensely do you want to do it? How often do you want to do it? How much weight, or I guess that's the same as intensity, but are you doing it too long? Are you doing it too often? or are you doing it too intensely? And one of those variables needs to come down if it's causing pain that's late and pain that lasts long after the provoking activity is stopped.
Yeah. To kind of rephrase what you put when you were talking about the stimulus and interpretation, I think an example that other people can relate to, and it's really the same thing occurring, is if you've ever, like, you found a bug crawling on you, or you saw a bug, and then now all of a sudden every little stimulus, maybe it's just a breeze, the AC kicks on, you have some hairs wiggle on your arm, and now your brain's convinced you got bugs. And it's similar to that. You get to this high alert stage, and then you just start anticipating all of the stimulus and how your brain starts immediately interpreting. And sometimes you got to turn on the lights and look, and you're like, okay, there's no bugs in my bed. So, one of the things that tends to occur with on the athletic training side is people will get off my table, they're going to feel great, or maybe they had just seen Dr. Ben and they get off his table and they feel great, and then they immediately go home and then they start doing all of the chores they've been putting off. And it really comes down to an understanding of recovery and what recovery means, and that association with, if I don't have pain, I'm recovered. You guys mind exploring that for just a couple of minutes? Maybe start with you, Ben.
That's a big one, because I get that question a lot after the adjustment. Is there anything I need to avoid doing? So my back was hurting so much. Do I need to not do things? Like, of course, you can go about most of the normal daily stuff, driving and cooking and whatever. But just like you were saying, Andrea, they go in and because they feel better, they just go whole hog into whatever it was they've been avoiding or putting off. And then they give themselves new problems on top of what they already had come in for. And I get where it comes from, because when we feel better, to give a specific example, my wife is like this, very much so. She constantly feels like
Careful
she's not
now.
doing.
She might watch this.
This is a pro thing. She constantly feels like she's not productive if she's not constantly doing things. So she's always active and always looking for something to put her energy and her time towards. And when she takes time for herself to relax, she feels like she's being a bum. She feels like she's no good, because there's that disconnect between doing nothing, so to speak, relaxing, resting, and recuperating is doing something. But we have this idea that you have to be actively moving and working to accomplish anything. But resting and relaxing and allow the body to do what it needs to do is a productive thing. And I think that would be a good cultural thing to kind of help push and get into the mainstream ideas, that taking time for the self is important and worthy.
Yeah, that's a great example of, that social pillar of wellness, and, how we perceive ourselves or think others will perceive ourselves, and our overall culture and how it affects our health and our attitudes towards health. Anything you'd like to add on that topic? Because I know we're getting a little low on time, and there's a couple other things I want to try and squeeze in here before we run out.
Yeah.
Sure. One of the main things is that when people who suffered for a long time have a good day, they never know what tomorrow's going to be like. And so there's this tendency to want to try to get everything done in one day. And, I better take a hold of this window of opportunity while I'm feeling pretty good, because I saw the chiropractor or the massage therapist or the physical therapist. And I'm going to go get all this stuff that I haven't been able to do done. But that almost guarantees that the next day they're going to be miserable as a result of that. And it's hard to accepting where you are and what your current capacity level is. But kind of knowing what's sore but safe and what's too much and it's going to cause a flare-up is a good thing to know. And that, if it takes a certain amount of activity before you start to have pain, and you just keep pushing and pushing and pushing back past that, then, eventually the next day you're going to crash. And over time, I kind of was drawing a brief sketch, but over time, if you keep pushing past the point where you have pain, over time it takes less and less and less activity before you actually start to have pain, and your capacity to do things becomes less and less. So accepting where you're at and knowing that by not exceeding that by too much, you'll be able to get better over time. But if you try to get everything done today, you're probably going to feel worse tomorrow.
Yeah, whenever you have these days where you feel good, that's the time to delay that gratification and invest in more good days by just holding off a little bit, taking it slow, and allow that recovery process to take place.
There was a phrase that I was reminded of with it, which was
one of the things that I really want to drive home here is that. Go ahead. No, go ahead.
Okay, it was just going to tell. It popped into my head is if you don't make time for your wellness, you'll be forced to make time for your illness.
Yeah, that's a great saying. And so one of my personal philosophies as just an allied health professional is, navigating this stuff is highly individual. Everybody has their own goals, their own lifestyles. While we live and interact with similar technologies and tend to have very similar problems, how we develop them may vary drastically. And so as an allied health professional, we're like tour guides or trail guides. In other words, you're on a journey to get better. Your journey looks different than anybody else's journey. And we may not have all the answers right away because it is very complex. We don't know what's around the corner, but I've taken this journey enough times with enough people that I have some idea what you're in for, and I'm going to help you navigate these obstacles. And if we have an obstacle that we did not anticipate, we'll handle it when we get there together. And I think that's one of the roles, like if somebody's looking. So let's say I'm an individual, I'm suffering from chronic pain. What should I be looking for in a professional whenever I'm seeking help? Like, what kind of paradigm or mindset should this professional have to help me get the best from them?
Well, one thing for sure to hammer on, which was one thing that Dr. David said, find a practitioner that's going to listen to you. That is the biggest thing, because if they can't listen to where you are and understand where you're coming from, it's very, very difficult for us to meet you anywhere that's relevant to you. So we have to know where it is you're coming from, because we bring our expertise to the table, but you bring your experience and your life to the table. We have to tap into that to know how we're going to get them to mesh, and that's our job. That's our responsibility.
Anything to add to that, Dave?
Yeah, I just kind of second that. That's really the best piece of advice I can give you, is that someone who's going to take the time and get an understanding of where you are and where you want to go, and then be your tour guide to take you from point A to point B, rather than somebody who's going to come in and tell you where you are and where you need to go. That's really probably the drive with it. Someone who's going to help be an advocate for what you want, and not make you, like you said, advocate for yourself.
Mm-hmm. So as we wrap this up, I just want to kind of quickly summarize where we're at. So we have this, when we're focusing on chronic pain, it's a very complex issue. It's involving many moving parts. There's the physiological aspect where we have, the nervous system, the muscular system, the skeletal system, our endocrine systems all working together. And then we also have the mental and emotional aspects. We have our patterns that we fall into as we may avoid certain activities. And then there's this aspect of recovery, which is it's like walking through a dark room blind in a room you've never been in before. And we need to rely on these guides to kind of help us get through the other side. And so it's very difficult to navigate on our own and get out of that roller coaster that inevitably leads to, more medications, more pain, less activity, which then continues to perpetuate the cycle even further. So what advice would you give? I know one thing on my end that I've noticed is that I think some of it goes back to kind of chasing pain or chasing symptoms rather. I got an appointment with my chiropractor, and it's, I need it. I'm in pain now. I'll see him in 2 weeks. And then the chiropractor says, I recommend you get a massage for these muscles so your adjustments hold longer and you get better relief. And then they schedule that appointment, and that's 2 weeks out. And then, they may go talk to their doctor because it's chronic and it's not getting better. And they say, well, here's a prescription, and I'm going to go send you to see Dr. Dave. So, at what point, what can they do in terms of time in addressing these issues? Is this something that they should stay on top of regularly? What does that process look like? How should they be making appointments, and with who? maybe start us off, Dave. And I think this will be kind of how we wrap up this discussion. We've hit a lot of good stuff. We could talk about this for days, I feel like, and not cover everything associated with pain.
Yeah, agreed.
Yeah, I agree with you. Basically, as soon as you're tired of suffering, you should seek out someone who can help you. And if you don't like what they have to say, find someone else. If you don't like what they have to say, find someone else. There's lots of resources. You can talk to family members or friends or other people that you trust, and find out who's help them, and talk to them not just about a name but about their experience. Find out what they liked and what they don't like, and what they wish could have been better, and what was really great. And create your own experience. Make your own path. Don't wait for someone to kind of guide you, because I think a lot of people get in our medical system pushed around from one doctor to the next, to the next, to the next. And like Andrew said, you almost kind of have to advocate for yourself and know what you want and pick the direction that you want to go in.
Yeah, perfectly put. I seconded.
Great. So the key thing, though, I think at the end of this is, to break these cycles, at a certain point, you have to stay on top of it, right? If you get a treatment for a symptom today, maybe via the chiropractor, and then 2 weeks from that, it starts bothering you again, you see the massage therapist, or maybe you're just seeing the same professional. The idea is we need to confront these rooted issues on multiple fronts, and consistently enough to actually get that root out and stop that cycle, right? Any last bit of advice on the cycle and ways to start confronting that or even understand it?
From my point of view, I would look back at those pillars, right? Mm-hmm. Social, financial, et cetera. So each professional, we have our specialty, right? And for the majority of us, it's physical. That's where our emphasis is. So part of the onus, I think, is on us to build good relationships with other people who see things the way that we do or complement what we do, so that we can refer and get a good group of people together to help people's total wellness, right? Because we can't specialize in it all. It'd be great if we could, but the goal being the patient. So making sure that they have access to everything that they need, whether it comes all from us or not.
That's good.
Yeah, I'd agree with that, especially, when you are a first-line practitioner and you may be the first one someone seeks out, and knowing what's in your wheelhouse and knowing what you can manage and what you manage best, and then knowing enough about all the other stuff to know who they need to see and have appropriate referral sources for things that are outside of your scope, outside of your expertise.
Exactly.
Awesome. Well, thank you, guys.
Yeah, and thank you for moderating it.
Great to be here. Thanks, guys.
Have a good day.
You too.
That was a lot of fun. I had a great time talking with Ben and Andrew, and I hope you guys listening to this at home enjoyed it too. I have a couple programs that I'm excited to announce the start of coming in 2021. And the first one that I'd like to announce today is an online course called Relieve Sciatic Nerve Pain at Home. And this really came about from hearing a lot of stories from people who have been less active, less mobile, sitting around at home, maybe not eating as well as they could be, to some extent stressed out. And so this program will address the physical things that you can do on your own at home, whether or not you're ready to get back out and see someone in the office. But it will also address some of the other factors, the nutrition factors, the sleep factors, the stress factors, all of the other things that are really the big predictors of chronic pain. Now, since this is the first time that we're running this program, you're going to have a really special opportunity right now to be involved in the formation of it and what you would like this to look like. So if you suffer from sciatic nerve pain or you know someone who does, you can email me at dave@stlpainexpert.com to get more information about the program, or you can visit stlpainexpert.com/sciatica, and that will take you to the page where you can get more information about it and sign up. This first round of people who go through the program are really going to have more value out of it than anyone ever will in the future, because not only are they going to be able to get the content that comes with the program, but it'll also include an 8-week group coaching program along with individual consultations with me, so that we can really tailor this program for the future people who go through it. And for that, you're actually going to be getting the most value this time through for the lowest price that the course will ever be offered. So if you or someone you know needs help for sciatic nerve pain and would like to be able to do it from the comfort of your own home, visit stlpainexpert.com/sciatica for more information about the program, as well as to sign up for the best price that this program will ever be offered. If you have any questions about this specific episode or questions about chronic pain in general, feel free to email me at dave@stlpainexpert.com. Or if you'd like to get a copy of my book, Chronic Pain, You're Not Just Getting Older, You're Not Crazy, and It's Not All in Your Head, then you can get a copy on Amazon, or we have a forwarding link set up at stlpainexpert.com/book. Thanks for listening today, and if you enjoyed the content of this episode and you'd like to get more like it, give us a 5-star rating on Apple Podcasts, and click the subscribe button to get notified of our future episodes. Thanks again for listening, and have a great day.
Thanks for listening to the St. Louis Pain Expert Podcast. We hope you've enjoyed the show. If you live in the St. Louis area and would like Dr. Candy's help to find a solution to your pain, visit our website at stlpainexpert.com. Email Dr. Candy at dave@stlpainexpert.com, or call Dr. Candy's clinical practice at 314-941-3970. If you're listening from outside the St. Louis area but would still like some help, feel free to contact us to learn more about our virtual health coaching. Regardless of where you live, please share our podcast with anyone you know who would benefit from learning more about pain and what can be done to relieve it. And don't forget to subscribe to our podcast on iTunes, Google, Spotify, or your other favorite podcast platform so you get notified when we release a new episode. Thanks again for listening, and we hope you'll enjoy us again soon.